All right, we just put it on live stream. Okay, welcome everyone. We are the NMBF Coffee Chats, and I'm Abhijit, your host for this Zoom event. Thank you everyone who's joined today. As we had mentioned in the link circulation that mental health awareness is so important, and in fact, the lack of mental health awareness is one of the major reason why many people are suffering, many families are suffering. Many societies are suffering today because of that, and we really want to thank you all for showing interest in this very, very important topic. And we want to, we are basically a church-based platform, and we always look for opportunities to serve the society. And we really want to thank God for this opportunity that has come to us in the form of Dr. Sheryl, who's here to share her expertise, her views on this subject. And for those of us who are new, who might not have known her, some of you remember her from the wonderful session we had last time on sleep management. But for the sake of people who are new, I would like to take a couple of minutes to introduce her. Dr. Sheryl John Senthilathan is Nathan is an eminent psychiatrist born and raised in Mumbai, a celebrated speaker on mental health. She has a thriving psychiatry practice as she consults Dr. L.H. Hiranandani Hospital, Powai, and Holy Spirit Hospital, Andheri East. Dr. Sheryl specializes in treating young adults, women, and families. She's completed her MD psychiatry from the esteemed Medical Institute of Mumbai, Lokmanya Tilak Mumbai Medical College and Hospital. Completed a training in the Kharkov method of counseling from St. Xavier's College, and did an online training module in DBT and under Marsha Linehan, USA. She's on the board of trustees of FIAMC, International Federation of Catholic Medical Associations. She was the honorary treasurer of Bombay Psychiatry Society earlier. A passionate advocate of community mental health, she wants to promote mental health awareness and contribute towards destigmatizing mental illness, and conducts various talks across the length and breadth of the country. She's an invited speaker at both national and international conferences. Yeah. So a warm welcome once again to Dr. Sheryl. Thank you so much, Dr. Sheryl. We need so people, doctors like you, are passionate about mental health awareness. So welcome to speak on this topic, making
Thank
the
you so much,
invisible
Abhijit.
visible. Yeah.
So I'll just share my screen.
Yes, yes.
My screen visible now?
Yes, yes. No, not yet.
Okay, just a minute. Is it visible now?
Yes, it is. It is very much. Okay. Yeah, please go ahead.
Okay. So a very warm good evening to one and all who've taken time. It was almost good night, I think, for a lot of people. I know it's a very late evening program that we are having, and I think we are doing this timing for the convenience of people who are working and then coming back home, and we wanted to do on a Friday evening so that we can reach out to more people. And this outreach or this reaching out to people is very, very important, because we're talking about a very, very important aspect of health, and that's why we titled as Making the Invisible Visible. I always like it to be a little interactive session. So I know that, if if you have anything to ask or say, you could raise your hand and then we could unmute you, or you could put it up on the chat box and then we can take it from there. So we're discussing mental health. And can anybody tell me, when we're talking about mental health, what are we exactly talking about?
Yes, anyone would like to respond? What is mental health according to you? Anyone? Friends, feel free. You can put it on the chat or unmute and answer.
It's being
Is it like our
whole mind and spirit.
Sorry, sir. I'm sorry, we could not hear you.
Brother Peter?
It's being whole, body, mind, and spirit.
Okay.
Body, mind, and spirit.
Okay.
Yeah.
Thank you, Brother Peter. Anybody else?
Yeah. Rahul?
Is it our attitude towards life, daily things, towards family, towards work?
So our attitude towards things is what you feel is mental health. These are all different aspects, right? I mean, so when we're talking about our attitude or our mind, where exactly do you think this mind exists? Anybody?
In our thoughts.
So in our thoughts. So our mind is in our thoughts, and where are our thoughts?
Yeah. There are some responses on the chat also.
In our experiences, like how we interact and how we respond and how we get responded to.
Okay. All of these are very, very important and significant parts of what we assume is mental health, right? We think that it's in our attitude, we think it's in our experience, we think it's in our thoughts. But we tend to kind of forget the most important aspect, which means mental health is actually the health of your brain. It's unfortunately not the health of your mind. It's not the health of your attitude. It's not the health of your experiences. So today I just took off my, watch because then if I get anxious, my heartbeats will increase and my watch will pick it up. And if my watch is picking up my heartbeat increasing, I know that that's because of this organ that's beating in my chest that's causing a problem. In the same way, when we address mental health, when we are talking about our attitudes, when we are talking about our thoughts, when we are talking about our experiences, all these are stored and consolidated in a structure in our body known as the brain. And the faster we accept it, it becomes easier for us to accept mental health as physical illness. Right? It's extremely important to understand that mental health means physical illness impacting an organ of my body, and that's my brain. And why is it important for us to understand that? This is just I haven't put the references, but this is data, recent data, 2022 data, which says that this was data, published post COVID-19, where 67% of people reported higher levels of stress. 57% said that they have greater anxiety. And these are the data. Now, before COVID, if you had looked at the incidence of mental health problems, कि जब mental health problem होती है, तो 9 में से 1 जन को mental health problem हो सकती है. हम लोग, I think, ये meeting में 40 जन हैं. This was 2019. आज का डेटा ये कहता है कि 1 in 5 people. मतलब हम 40 जन हैं, इसमें से 8 जन को कभी ना कभी, including me, कभी ना कभी हमारे लाइफ टाइम में मेंटल हेल्थ प्रॉब्लम्स हो सकती हैं. So it is that common a problem. It is not something which is very, very rare. And something which is so common, we need to understand, right? So are we immune? आपको लगता है कि हमें ये प्रॉब्लम नहीं हो सकती है? Do you think कि हमको ये मेंटल हेल्थ प्रॉब्लम नहीं हो सकती है? हम बहुत स्ट्रॉन्ग हैं, हमारा फेथ बहुत स्ट्रॉन्ग है, हम एक्सरसाइज करते हैं, तो हमें ये मेंटल हेल्थ प्रॉब्लम नहीं हो सकता. सो इट्स नॉट ट्रू. बहुत, जैसे मैंने कहा, 1 in 5 people experience mental health problems, but most of us will struggle in silence. हम किसी को बता नहीं सकते. क्यों नहीं बताते? Because ये एक बहुत बड़ा स्टिग्मा रहता है इसके साथ. पागल है क्या मेंटल हेल्थ प्रॉब्लम? ऐसा कुछ होता नहीं है. तुम अपने आप को स्ट्रॉन्ग करो. तुम्हारे लाइफ में प्रॉब्लम क्या है? क्या ये तुम मेंटल हेल्थ, ये सब नया नया बताते हैं. हमारे जमाने में कुछ नहीं था. हमारे जमाने में एक लाफा लगाओ और ये डिप्रेशन भाग जाती थी. तुम लोग को लाफे की जरूरत है या लात की जरूरत है, राइट? हम यूजुअली ये सुनते हैं. क्यों? क्योंकि बहुत ज्यादा stigma is associated with mental health. The words पागल, crazy, mad or what, हर चीज में हम अप्लाई करते हैं. तो अगर हम सच्ची में सफर करते हैं तो हम बहुत हेजिटेट करते हैं किसी से बात करने के लिए. We take a lot of it takes a lot of courage for us to accept that we have a problem, which is very strange, because if I have a cardiac problem or I have a breathing difficulty, I so easily go and talk to somebody. But if it's something to do with my thoughts, with my mood, I'm a little apprehensive. And our Bollywood or Hollywood movies have not really helped our cause, because उसमें भी ऐसे दिखा जाता है कि जिनको mental health problems है वो बहुत ही विचित्र तरीके से behave करते हैं. So the stigma associated with mental health is huge. And today what we are trying to do is, we are not trying to solve the problem. We are trying to see, is there a problem? And if there is a problem, what do we look for? हमें कैसे पता चलेगा कि मुझे या मेरे घर में किसी को या मेरे आजू बाजू किसी को किसी भी तरीके की मेंटल हेल्थ प्रॉब्लम है. और आज स्पेसिफिकली हम सिर्फ डिप्रेशन और एंजाइटी के बारे में बात करेंगे. मेंटल हेल्थ डिसऑर्डर्स आर ह्यूज and we have so many disorders to cover. This is part of our series, so we are only going to be talking about specifically depression and anxiety. So I want to ask you, what do you mean by depression? Because we use this term very loosely, right? जब मेरे पास पेशेंट्स आता है ओपीडी में तो हर जन कहता है कि मुझे डिप्रेशन है. And then we have to evaluate what exactly is the problem. तो क्या आप मुझे बता सकते हो? Can you tell me what do we mean by depression?
When we get less marks in academics, we feel depressed when we got results.
Okay. When we get less marks in our exam or in academics, we feel depressed. Very good. Thank you. Anybody else?
At least during the results dates, when the result came, first 3 days or 1 week.
Correct. So thank you so much for this. So when the result comes and you're done badly, then for first 3 or 4 days, you'll be feeling very, very sad, and then you will get back to your routine.
Normal, yeah.
Yes. Anybody else?
Anxiety.
Low esteem.
Sorry, just one.
Low esteem.
When you feel low self-esteem, okay?
Anxiety is fear of future, and depression is probably your past thoughts or your failures that you go through.
So depression is when according to depression is when the thoughts keep on coming and they disturb you. So like correctly, the young gentleman who talked about, I'm having a problem, I have not done well in my exam and I feel sad, I'm depressed for some time. But we do not call that as clinical depression. Today we are discussing what do we mean by clinical depression. I have had, let's say, a fight with my husband, and I'm very upset and sad about it. And my sadness may go on probably for a week or so till we resolve our problems, and then I'm back to a situation. I was promised I will get a promotion at work, and when the time of the promotion came, I did not get a promotion. I'm going to be sad and upset. This is not clinical depression. There is an environmental problem. There is a problem, और वो प्रॉब्लम क्योंकि खराब है, मुझे उस प्रॉब्लम की वजह से उदासी लग रही है. एंड जैसे प्रॉब्लम ठीक हो जाएगा, मेरा उदासी चला जाएगा. But when we are talking about depression as a disorder, as a mental health concern, this is what happens. A person, you will feel sad most of the time, nearly every day for more than 2 weeks. जिस चीजों में रुचि है, the interest in things, जिस चीजों में मजा आता था प्रोग्राम देखने में, चर्च जाने में, घूमने जाने में, you are no longer interested in doing the things which interested you. Weight loss or weight gain, either you are binge eating a lot or you are completely lost your appetite. Sleep, a very important aspect. नींद नहीं आना या नींद ज्यादा आना. Feeling very tired, feeling very lethargic. Like some gentleman said, that thinking about the past. Yes, lot of things of the past which you may have at that point of time not realized, but now if you are having depression, आपको लगता है कि वो सारी चीजें बहुत गलत है. A lot of guilt feelings. I have a lot of clients when they come with depression at the age of 60, they will talk about cheating in an exam when they were 12 years old. and feeling sad and upset about it. That means जो पास की चीजें हैं, पास की गलतियां हैं, वो प्रेजेंट में बहुत ज्यादा हॉन्ट करना. Feeling very, very guilty, hopeless, worthless. Students complain of lack of concentration. And a lot of times we feel that life is not worth living. Right? So these are the symptoms of depression. Now, these symptoms are there for more than 2 weeks. Then you have to take professional help. That means it is clinical depression. And we will talk about why clinical depression happens a little later. Now, I want to give you, I hope that you've understood what are the symptoms of depression. But everybody does not come like this and say, okay, I'm feeling sad. मेरे को रुचि नहीं है, मेरे thoughts आ रहे हैं. Everybody comes up with different symptoms of depression. And like I said, this program is to create awareness. तो हमें ये awareness create करना बहुत जरूरी है कि depression के और क्या-क्या लक्षण हो सकते हैं.
Madam, can you speak only in English? Because
okay, I'll do that.
We are from other states also.
Okay, I will do that. I'm so sorry. Yeah. We'll speak in English. So we have to understand what I was telling you is that these are some of the symptoms of depression. But sometimes a person may present with completely different symptoms, and it's important for us to understand whether this person is having depression. So I just want to share some stories with you. So this is Sam. He was a first-year engineering student. As the semester exams were approaching, parents got a call from the college. He's not attending college. He's not submitted his projects. He has not sat for any internal exam. At home also, the parents were observing कि काफी दिनों से he was very angry, very irritable, staying in his room all the time. Now, this anger, irritability was happening for some time, but parents thought it's because, he's a young boy, he's going through some changes. We will leave it and let him kind of, come out of this anger, because he was getting very, very angry at home. They got concerned when he started doing poorly in the academics, because they were very shocked to know that he has not attended college only. Exams, he's not given his exams, he's not submitted his papers. So sometimes a person can present with anger. Anger can be a sign of depression. So it need not always be sadness. And in young adults, in children, we see depression right from the age of 8 years onwards. And young children sometimes may not present as sadness. They'll be very, very irritable, very, very angry. Small things and they will be crying. And we don't understand why that's happening. So anger, constant irritability, a change from before. I'm not an angry person. I'm not an irritable person. But last few weeks I've become very angry, very irritable. We should be alert that is this depression? Is this person going through a mental health concern? Poor performance in exams can be a sign of depression. Now that doesn't mean if you're doing poorly, always you have depression. Depending on your ability, depending on your capability. Suppose you are doing an average student, doing average well in exams, and suddenly there is a big dip in your exam results. It can be a sign of depression, because depression impacts what we call as cognitive functioning. That means your thinking ability, your processing ability, your memory, your concentration. So that can be also a sign of depression. This is Sudha. She was a 35-year-old IT professional. And for the last few months, her project was with a US team. So this caused her to change her sleeping pattern. She was not following the India sleeping pattern. She was working for the US client. So she was working according to their pattern. And she thought, "Theek hai, when this project is over, my things will get better. I will be able to get back to my normal routine and sleep." She waited for some time, but that was not possible. She thought it's because she's worked for so many months, I will give it some more time. She gave it a lot of time for her sleep to settle. She came to us when she realized that she couldn't concentrate at work. She was a high performer at work, but what happened is she started making a lot of mistakes. Her bosses started calling her, "Bare Sudha, what are you doing? Itni simple si cheez, you made a mistake." So then she got concerned because her sleep as well as her performance at work got impacted. Why is it important to look at sleep disturbances and mental health together? Because sleep disturbances is a very, very important warning sign for depression. About 90% of patients who have depression actually come with sleep complaints. So in our OPD, I will have a person who's come from the neurology department, from the diabetologist, from the orthopedician, because the person is not able to sleep. And we have to kind of understand that is the signs of depression. Many times people say, so what if I'm not able to sleep? I'm just going to take a sleeping pill. My general physician has given me a sleeping pill. I'm able to sleep well, that's fine. But what happens over a period of time? Those people who suffer from sleep disturbances, their risk for suicide increases by 34%. This is a huge number. And when you and I are looking up and opening our newspapers, reading about articles about young adults committing suicide, the second most common cause of death in the young adults, that is between 15 to 39 years of age, is suicide. So we're losing our young adult population to suicide, and that suicide is because of depression. And sleep disturbances is a very, very important sign of depression. So we as a community need to be alert and aware about this. When somebody is telling you that I don't want to live anymore, what should your response be? What should you say?
Anyone? What should your response be? Yeah.
You want to talk about it?
Do you want to talk? Can I? Yes.
Do you want to talk about it?
Do you want to talk about it? Yes.
Can I help in any way?
Can I help in any way?
How can I help you best?
How can I help you best?
I think maybe get to the root cause of why the person is feeling suicidal. Because first of all, the person is believing a lie, in
What
their
lie,
mind.
sir?
I mean, that it's the lie of believing that life is not worth living. It's hopeless. So we need to bring hope, and we need to bring the truth to that person. Okay. That yes, that life is precious. Your family loves you. We love you. That kind of thing. So bring some kind of hope and get to the root matter. Why is the person feeling suicide?
These are very nice and important points that we have raised, but we have to also look at it as if somebody is expressing suicidal thoughts and ideations, that may not be the appropriate time to say a lot of things, right? And I'll tell you what we should not say before I can tell you what you should say. You should not tell them you're just seeking attention. A lot of times people will say, oh, this is just for attention. Kuch karne wala nahi hai, aise bol raha hai. Right? Or we'll tell them, you'll get over it. It's only a phase in your life. You'll get over it. Think about how this will affect your family. Why are you saying these things? What will happen to your parents if you do commit suicide? What will happen to your friends? Snap out of it. Just be positive. Have hope. You have so much to live for. Others, have nothing and you have so much. Why are you thinking about these things? Suicide is selfish. Suicide is a sin. Suicide is a crime. You're being very irrational. You're not the only one who feels this way. Even I feel like that sometimes. You should be grateful for what you have. I know exactly how you feel. You can never know how that person feels. We cannot know. I cannot know how each one of you feels, right? And if I'm making this statement, what happens is you're too strong to let this get to you. You're strong. Your mind is strong. You should not think about these things. Have you tried this? You're being very dramatic. This is all in your head. So kindly, I hope at least a number of people that we are in this group, from today, we will not make statements like this. Because when this person is talking about, I don't want to live anymore, the person understands these aspects. The person knows that my family is going to be impacted, but it's his illness which is causing him or her to feel this way. And our making these statements are not going to help. So what should we do? We express concern and care. Ask open-ended questions. What can I do for you? How can I help? Like somebody said, how can I help? Listen actively and non-judgmentally. The person is not looking to you for advice, and you as a lay person cannot give advice to somebody who is suicidal or is thinking about suicide. You have to just help the person vent without any judgment, without any comments, without any advice. The most important thing is validate their feelings, because the previous statements that we are saying makes them feel that tum aisa feel nahi kar sakte. You cannot feel all these things. It's wrong for you to feel these things. So the person will become closed again and will not open up. And we have lost an opportunity to save a life. So it's very important to validate their feelings. We have to encourage professional help. Offer reassurance that we are there for you. Stay with them till you are sure that they are safe. And this is very, very important. If a person is talking about suicide and death, do not leave that person alone till you're sure that that person has taken professional help. What will you do if you get chest pain? Suppose one of us now is experiencing chest pain. What will we do?
Anyone? Any response? Yeah, go ahead. Samuel?
Like this gentleman here, we're having chest pain. So what will we do?
Person also call 108, if there's nothing that we can immediately do, at least call, 108 as an ambulance for help.
So the ambulance will take the person to the hospital, right?
Yeah.
And why would you want to do that?
Because we don't know what, we can't handle the person immediately. So that will be one thing. And then be with the person till that help comes.
Correct. Because when he's complaining of chest pain, you're thinking that this is a heart attack, isn't it? And you want to take help immediately. You're not thinking it is a chole that he ate and that's caused the gas. You're not telling him, oh, this is gas. The moment he's complaining of chest pain, you intervene immediately and you rush the person to the hospital. In the same way, suicide is one of the most important psychiatric emergencies. So if anybody talks about suicide, you have to take them to a mental health profession. There is no dilemma, no ambiguity, no right and wrong here. Anybody who expresses death wishes, anybody who expresses suicidal thoughts, you have to take them to a psychiatrist or a mental health profession, because this is a psychiatric emergency, right? And suicide is the only cause of death which can be prevented, right? And if we intervene in the right time, we'll be able to reduce the number of suicides that we are seeing on a daily basis. Let me move on to another story. This is a 40-year-old lady who had gone to her doctor for pain in her left knee. A lot of us have pains, aches and pains. I just started exercising recently and I can't even walk. My knees are hurting all the time. But her pain was aggravated while walking. She was sitting down and getting up. Lot of pain, given lot of medications, painkillers were given. The pain became a little better. But after a few weeks, the pain came back again. And this time it was in her back. And no matter what medication she was taking, it was not getting better. She went to her orthopedician, her bone density test, x-rays. She got even an MRI done. Nothing can be picked up. Yeah, some changes, some degeneration, but not enough to explain why she was experiencing so much of pain. So pain can be also a very, very important symptom of depression. And how and why would pain should be a sign of depression, right? It's a physical thing. We'll think it's a physical thing. And like I told you right in the beginning, the mental health is associated with the brain health. 50% of patients with depression present with pain symptoms. So they don't come with sadness, they don't come with sleep disturbances, they come with pain symptoms. What kind of pain? The pain is very, very vague. It's quite unexplained. It's not in one part of the body. Sometimes it's a headache, sometimes it's shoulder pain, sometimes it's back pain. A lot of time, children with depression come with abdominal pain. Stomach is hurting, don't want to go to school. A lot of muscle aches and pains, and these take the form of multiple pain symptoms. Why does it happen? We constantly get sensations from every part of our body. When my stomach is moving, when my hands and legs are moving, I'm getting signals to my brain constantly. Now, I don't have to focus on all these signals all the time. And what happens? My brain releases certain chemicals which suppress these extra signals coming all the time. In depression, when these chemicals become lower or they become dysfunctional, my pain symptoms become more. So my threshold for pain, my symptoms of pain become more and more. So pain is a very, very important symptom of depression. This is 72-year-old Mr. Menon. He was brought by his family.
I have a question here on the pain.
Yes, ma'am.
Yeah,
Yes,
actually, a lot of people at the elderly age, they experience pain, because of, the tendency of the muscles not to be efficient and all. But they're also experiencing depression, maybe. So is most of the pain in the old age because of that level of depression that they're going through most of the time?
Yes, it can be a combination of both. It's a combination of both because with the age, like I'm just going to talk about the 78-year-old Mr. Menon. So you just kind of asked the question at the right time. I'm talking about this 72-year-old patient of mine. But yes, pain can be a very, very important. So if the pain is not getting better with orthopedic help, with painkillers, and you must look at evaluating it for depression. So I'll get back to my story of 72-year-old Mr. Menon. He was brought by his family because he was not ready to participate in any of the activities that he was doing before. They had a very great senior citizens club. He was doing all that before and he did not want to go. He wanted to be in his room. He couldn't remember whether he ate his breakfast. Sometimes he missed the dose of his medications. He kept misplacing his things. And everybody thought he's 72-year-old. He's supposed to forget. It's part of aging. They got most concerned when he started talking about, oh, I have lived my life enough. I hope that after this life, I don't know what is the meaning in life for me. Where am I going to go after this? Those kind of things got the family very, very alert that there is depression going on. Right? And depression is also quite common in elderly. About 8 to 20% of older adults in the community experience depression. Depression is a foremost risk factor for suicide in older adults. This is Soumya. She's 33-year-old, very excited because she had conceived and she was looking forward to the arrival of her baby. She delivered a healthy baby boy. After discharge from hospital, she could not sleep. And everybody said, oh, that's because of the baby. You're having very erratic baby feeding times, sleep timings, baby sleeping, you're not able to sleep at that time. All those things you're attributing it to that. Gradually, she started feeling very, very restless. She was sad all the time. And what disturbed her most was a lot of thoughts and images of harming her baby. And she came to me and said, Doctor, I don't want to harm my baby. I love my baby. I've had this child after a lot of prayers and interventions. So I really love my child. Why is it that I'm getting all these ridiculous thoughts in my head of harming my child? So what is happening here? She could be having postpartum blues or postpartum depression. And this is something which goes unaddressed a lot in our society. Women mental health goes unaddressed a lot because everybody assumes that women are supposed to bear most of the pain that they go through. And it becomes even more difficult for a young mother or a person who's just delivered a baby. Why is it? Because most of us experience some changes post-delivery because of the hormonal changes happening in our body. And everybody, all the elderly people in the home, including if I had gone through it, my mother would tell me, oh, all of us have gone through it. So what? It's a part and parcel of motherhood. Yes, sometimes you will experience, for the first 2 or 3 weeks, you may experience something that we call postpartum blues. Here you're more reactive, you're crying for small things, You are, everything is happening around nice and happy, but you're very irritable. You're not able to sleep. But what is important to differentiate between this and depression is you're happy. Your mood is happy, but you're still irritable. You're not able to sleep. This is because of the postpartum hormonal changes. This was a expert, which, a paragraph from this book by Brooke Shields. She's a very famous Hollywood actress. And she spoke about her journey through postpartum depression. And this is what she had said. I started to experience a sick sensation in my stomach. It was as if a vice was tightening around my chest. Instead of nervous anxiety that often accompanies panic, a feeling of devastation overcame me. I hardly moved. Sitting on my bed, I let out a deep, slow, guttural wail. I wasn't simply emotional weepy like I had been told I might be. This was something quite different. This was sadness of a shockingly different magnitude. It felt as if it never go away. So postpartum depression is very, very common. Here the person is sad, despondent, tired, very, very irritable, not able to concentrate, feeling inadequate as a mother, a lot of thoughts and images of harming the baby. And very important for us to recognize, like I said, when you open the newspaper, you will see so many articles. Young mother took her child and jumped out of a building. Young mother took the child, newborn baby, and jumped into the well, jumped into the river. It's not because there was some stressor. Of course, stressors will aggravate the situation. It was that we missed the postpartum depression in that young mother. This was again a very, very important part of it, and why I wanted to read. I was holding my newborn and could not avoid the image of her flying through the air and hitting the wall in front of me. I had no desire to hurt my baby and didn't see myself as the one throwing her. Thank God. But the wall morphed into a video game, and in it, her little body smacked the surface and slid down on the floor. I was horrified, and although I knew deep in my soul that I would do no harm to her, the image destroyed me. So it usually starts within 4 weeks, but it can happen 3 to 6 months also after delivery. It is related to some psychiatric history, can be related to environmental stressors, so important for us to identify. What happens if we don't identify this, right? We see there is a disturbed mother and infant relationship. Believe you me, when I see a lot of young adults with depression, with anxiety, and we go back, it's very important for us to go back to what we now in psychiatry call as perinatal psychiatry. We go back to the person's mother's history, how it was when the person was in the womb, how it was when the delivery happened. And we see that a lot of mothers at that time have had some kind of depression, anxiety, and not got that treated. And then the children later on have developed a lot of mental health concerns, right? It's very, very high risk for suicide. This is 20-year-old Shekhar. He was the third-year IIM student. He came to me with a lot of anxiety and sadness. He reported he was feeling sad for a very long period of time. Occasionally, he would feel fine, and then he would catch up on all his work. So he was an IIM student, a lot of pressure for him at work. But so he would have phases where he's not doing any work, then he would snap out of it, do his work and manage to be on his course of his education. So I started him on antidepressants, and within a few days he came back and he was so grateful, so happy. He told me, "I'm so happy, doctor, you have actually pressed a magic button. And I'm able to do everything. I'm able to play football. I'm able to go out and party with my friends. I've also taken up some extra work. You have changed my life." Like, okay, bring it on, life. I'm so happy. This should have made me very happy, right? Because I have this person who's a high achiever, an IIM student, and now he's so happy. But I was not too happy about this quick switch. It got me more alert that what's going on? Why has he suddenly switched from being so sad to being happy? So when you experience a roller coaster of emotions, a high as well as a low, you have to be very, very careful of something that we call as a bipolar mood disorder. When you start medication for depression, when you start medication, antidepressants, it takes about 3 to 4 weeks for the medication to work. So when I start medication, somebody comes back in a week and says, oh, doctor, you're like God to me. I have my antennae up. That something else is going on. This person is probably suffering from something that we call as a bipolar mood disorder, where there are two different poles. One pole of depression and the other pole, which is exactly opposite. The person is high, extremely productive, very, very happy. And many times we miss this because everybody around is very happy with that productive phase, right? And feels, oh, wow, he's doing so much. But it's Newton's law, what goes up will come down. So in the same way, if the person is very high for a long period of time, it's going to be followed by the depression. So we have to look at it, with a little bit of concern. From depression, we'll move on to anxiety. And a lot of times we have a lot of people who come to the emergency of the hospital with panic attacks. And how does a panic attack look? It can look like you're sweating, you can experience like nausea, you have tremors, you're feeling very agitated, heartbeat increasing, difficulty in breathing. So these are all signs of panic attack. You must go to the hospital and get it checked to see whether it's a cardiac event. So always get an ECG done if you're experiencing these symptoms and ignore it. But many a times it can be an anxiety attack. A lot of young adults are indulging in self-harm as a way of handling their anxiety. They tell me that, doctor, we have so much of emotional anxiety. We don't know how to handle the anxiety. And when I inflict that cut on my body, I feel a relief. It is not a sign of attention. It is not them misbehaving and not, wanting to trouble the parents. It is their sign and cry for help. And earlier, 20 years back, when I started practice, we would have a lot of young adults with cuts on their forearm. But now children are very smart. So they will cut on their thighs, they'll cut on their shoulders, where nobody can see that they have cut. So if your young adult or your young teenager or adolescent is showing any changes in behavior, be alert to any kind of self-harm. A lot of us experience a lot of phobias. We can have social phobia. I don't want to interact with anybody. I want to be by myself. Interacting with people causes me a lot of anxiety. You may feel claustrophobic, your closed rooms make you uncomfortable. You always want the door and windows to be open. Some of us are scared of heights. Some of us are scared of insects, cockroaches, right? Now, some of these things, for example, if I'm scared of heights and I stay on the ground floor or I stay on the second floor, I need not take treatment for it, right? Because it doesn't matter to me on a daily basis. I have to go to work, I come back, I climb up a flight of stairs and I go. I recently had a client whose office was on the 34th floor. And all her life, she had anxiety of heights. But now when she got her job and her office was on the 34th floor of a building, she had to handle her anxiety of height because she still managed to go by the lift in the 20th floor. And she said, beyond that, I can't go. Then she would get off on the 20th floor and walk another 14th flight of stairs. How could you do it every day? So then she needed to kind of, intervene. The same thing with insects now, because of very good pest control services, we don't have so much of insects that we have to deal with. But a lot of people do have phobias with insects. This is 16-year-old Sean. He had started isolating himself once he would come back from college. He was constantly arranging and rearranging his study table. He wanted things in a very particular order. If things were not in that order, he wanted them to rearrange so that they all the perfect order that he felt it should be. He would spend long hours in the washroom, constantly washing his hands. Initially, it started during COVID. So everybody thought that he's just being careful. You wash your hand, you sing the happy birthday song. And so that's why you're taking so much time to wash your hand. But when his fingers started peeling, he was having a lot of redness, but he would still not stop. And he would spend a long hours in the washroom, whether he's going to use the washroom, whether he's going to take a bath. He was like this, constantly arranging and rearranging the things. It had to be in a particular order. This was how he was washing. Anybody can tell me what is this disorder we are talking about?
OCD.
Obsessive
Obsessive
compulsive.
Yes,
Compulsive.
obsessive compulsive
OCD.
disorder. This is a great movie called Aviator, and this I've just picked up a scene from that. And the previous one was from the movie known as Good as It Gets. This also shows to people with OCD. It's obsessive compulsive disorder. A lot of times people don't come in for treatment for obsessive compulsive disorder because everybody thinks that it's not really causing a lot of problem. Now, why do we develop depression and anxiety? It's very important to understand that. This is something that we call as a stress diathesis model of mental health concerns. So if you have a diathesis or a predisposition or a vulnerability, you could have a genetic history, you could have a neurological problem, you could have a chronic illness like diabetes, hypertension. You have a vulnerability, and then if there is an added on stressor, you can develop a psychological problem. Now, without a psychological stressor, without a problem, also you can develop depression and anxiety. But a vulnerability makes you more common to have a problem. It's very simple. I have low calcium, and let's say Ishita has good calcium. On a day-to-day basis, I may having some aches and pains. Ishita is very fine. Today, I fall down a flight of stairs. Because I have low calcium, I will fracture my hand. And Ishita, because she has good calcium, if she falls down, she may just sprain. So our genetics, our biological vulnerability, and an added-on trigger can cause us to develop depression and anxiety. And again, I'm going back to our brain. These are the parts of the brain that get impacted when you're suffering from depression and anxiety. And I don't know how many of you watch Munna by MBBS, the movie? If you haven't, you must watch it. It's an iconic movie. It's a really nice movie. Nothing to do with mental health, but I'm just saying that it's a great movie. And there, Munnabai always says chemical locha. That is which happens in depression and anxiety. There is a chemical locha in your head. There is I'm just trying to make it simple to say there is a decrease in certain chemicals. It's not as simple. There are circuits in the brain which get impacted. There are neurotransmitters and receptors in the brain which get impacted. But to make it simple, you have to understand that probably there is a decrease in certain good chemicals. It's like, suppose I am making, let's say, mutton curry. And I buy the best mutton, I put everything perfectly, but I don't put salt in it. How would it taste? How would it taste without the salt?
It won't be tasty.
Correct? And suppose I tell you, you come to my house as a guest, and I tell you, sorry, I did not have salt. So I want you to imagine that there is salt in this and eat it. If you imagine and you will yourself to think that there is salt in that mutton curry that I made without salt, will it taste the same?
Better.
But will it get the taste of the salt?
No.
No, right? So the same way, when you tell somebody to, imagine that they'll get better, that is what you understand. This is a physical problem. Depression and anxiety is a physical problem with changes in the brain. So to summarize the symptoms that we spoke about, to understand that depression can present in a number of ways. It can be as lack of concentration, it can be sleep disturbances, pain, memory, postpartum changes. Be very alert to rapid changes in mood. Anxiety attacks have to be addressed. We can have different kinds of phobias, and OCD needs to be addressed and treated. Now, this person was skiing and he fell down and fractured his hand. What will you do? Anybody?
Take him to a doctor.
And what should the doctor do?
Give medicine.
Do a plaster and medicine.
Okay, thank you so much. Will we tell him no, do meditation? Will we tell that lady who fell down, it's okay, fracture hua hai, doesn't matter, you just meditate, your bones will heal together. Or even better, we'll tell them do yoga. Will we do that? We usually won't, right? Because that pain and that physical fracture is visible. What happens with depression and anxiety? Because it's not a visible problem. And because most of us come with the myth that it's in our mind and that thing doesn't exist, we tell people that, no, you try yoga, do some meditation, go for a walk, think positive thoughts, fall back to your religion, and everything will get better. So in the same way, like I would not tell somebody who's got a fracture to do meditation and yoga, in the same way, somebody who has depression and anxiety, you must understand that consulting a mental health professional is very, very important. Sometimes they will need medications. And medications have a lot of myths associated with it. People will say, am I going to get dependent on the medication? No, you're not going to get dependent on the medication. If I have weak eyes and I need to wear spectacles, am I dependent on that spectacles? How many of you wear specs? Anybody?
Yes, we are dependent on the specs, right?
No, is it a dependence or is it a need?
It is a need.
It is a need. That is the difference, ma'am, between a dependence and a need. So the same thing with medications for depression and anxiety. It's not a dependence. It's not that you're taking something and it's fixing it. It's a need. If certain chemicals are not correct in my brain, I need to correct it. Now, it depends on person to person about the duration of the treatment. Sometimes some people need medications. Majority of the people need medications for a short period of time. But there is a huge chunk of people who need medications for life. And if I look at depression like diabetes, if I look at depression like hypertension, where I'm taking medication, or I look at depression as a hypothyroidism or a thyroid problem, where I have to take medications for life, I will not be so concerned about the medications with depression. A lot of people will say, if you give medications for depression, it's going to impact the brain. The person is going to sleep all day. No, it's not. The idea of the medication is to make the person healthy, fine, active. So he's not going to sleep all day. If you know somebody who's taking psychiatric medication for depression, sleeping all day, go back to your doctor and get the medications altered and corrected. Are there going to be side effects? There are side effects to everything. We mix and balance everything and we decide. The side effects to me wearing specs, I may get a darkening of my nose. But there's a lot of myth and we need to break that stigma and myth associated with treatment for mental health concerns. Most important is to ask, and that means be aware and alert about the symptoms. You need to start treatment as early as necessary. And you must take the person to a psychiatrist or a mental health professional. It can also be a counselor or therapist who's good enough to identify if there is a problem, who's good enough to identify that is this person having an environmental problem which I can counsel and make it better, or is it clinical depression or anxiety which needs treatment? So thank you very much. I'm stopping sharing and then we can move on to the question answers.